Zach, yours has like the Elvis like flow.
I like it. I like a pump.
I like that. It's cute. Mm-hmm. That makes me comfortable with that. Yeah.
Anybody that wants to join? You still working?
My name is on the board.
Is it unknown? Oh, staff right here, okay. Didn't see that. Is that everybody that wants to participate? Yeah, okay. Alright, so the backgrounds are all pictures that Courtney has taken of me, because this is the only candid photos that she ever takes of me.
We can use this for our PowerPoint.
Zach, please make sure you're recording.
Yeah, it is.
Wait,
We're live.
I'm gonna make a
Don't worry.
slideshow.
In there, there's one or two of me from nursing school in my,
Okay.
puke green uniform as well. So
We can add these to the slideshow at the end of the year. If, yeah.
I love that. Oh, what happened? Oh.
That's not.
Oh, Thursday.
Was the pizza good?
Perfect.
22 points behind Zach.
Who's that?
It's the end of the semester.
You look so young right now.
Oh, that's
Such a
you.
wee baby.
I don't know when that was taken.
How old
What?
are you? Are all these gonna be related?
They're not all fully related. I have no clue. I just put them on there. She sent me like 20 photos of this week. The one I'm in nursing school, it's pretty bad. So- There you go. There they go.
Oh, I did that wrong, darn it.
Obstructive shock. So not directly related to the pumping effect of my heart. Things that's occluding the functioning of my heart. So cardiac tamponade.
That's like a lot of questions on the EAQs and NCLEX stuff.
And boom.
I know.
How much does that weigh?
That one? 4.5, 5. So supposedly I'm supposed to say 6'7" for everything now. This is
Yeah,
what we
yeah,
talked
right,
about
sure,
in today's
sure.
Bible study. So you're supposed to do this, whatever that means.
That was not.
There must be some young kids in your room.
No, there's a bunch of old guys and we were trying to figure out what 6'7" meant, so we have no clue.
That's the whole point, it doesn't mean anything.
Oh, there you go.
It has no meaning.
The kids will say it means everything, but nothing at all.
That's what I understand.
It was just put like below what?
Which Glasgow Coma scale range indicates a severe injury? Give me the range.
I had like 6 of those last weekend, 2 weekends ago.
It's at the Peanut Festival.
That's where I was at when I ate them. And then we stopped at Union Springs gas station. And
That's the worst thing ever.
we could not find a bathroom for a long time.
Can I not make it?
Review and.
Oh, there we go. Correct answer's perfect.
That was a big fish.
Okay, neuro assessment wise, changes in your LOC. So altered mental status, encephalopathy causes confusion, altered mental status.
Is that a sign?
Yeah.
That it is a sign?
Mhm.
I'm thinking it comes from.
Should we pause?
No, I'm gonna be back in time. I just realized I left things in the room when I was giving that book, guys.
Lactose free ice cream. I was in San Francisco and they were like, "You want a sundae?" I was like, "No, I'll pass." No, like, it's lactose free. Good, drooling. Remember that hoarseness, dysphagia, drooling. Good, airway management, number one thing. After that, I can fix other stuff. But airway management is my number one concern in the initial phase. Okay. Blocked tissue perfusion. Remember, as those microthrombi form, they're in those small little vessels, those little peripheral arteries, causing kind of a block in your arteries, and then that causes that decrease in the tissue perfusion, not allowing that oxygenated blood to get to those vessels. Okay. Double points. Did I do that? Perfect, well-defined insole. Secondary is gonna be a systemic response, not related to that first initial injury. We're not gonna necessarily have a delayed organ dysfunction, but it's just the defined insole, the initial thing. It's pretty obvious what's causing the initial injury, causing that organ dysfunction, okay? Perfect, quick and to the point there. Sepsis. Right, the pathophysiology is very closely related to it. So our treatment plan is gonna be roughly the same. Formation of microthrombi. Remember in mods, the reason for the organ damage is an increase in our lactic acid levels. So not a rapid decrease, but a rapid increase in lactic acid levels. Because of that cellular metabolism from aerobic to anaerobic. Okay. where they're not part of the initial injury. Good, secondary mods. Awesome. Influenza type B. Gonna cause that initial infection, causing that inflammation to occur. Trauma can be a cause, and your angioneurotic edema can also be a cause as well. Most common infectious agent, though, is gonna be that influenza type B. 3 more.
Where are you at in this photo?
So every time Courtney wants ice cream, this was backstory to this. Every time she wants ice cream, it floods down rain. And so I'm trying to order ice cream as it's like flooding inside my truck. So I have my little umbrella out there as I'm ordering ice cream.
Aw, look at that love.
Whatever she wants, I guess.
I know.
All right, number 1 priority, airway securement before manipulation or assessment or other types of things. Airway first. That was my first Ugandan meal. So if you think about it, when you hear abdominal distension and paralytic ileus, what system is that affecting? GI, right? If I said decreased urine output, union and creatinine are elevated, that makes me think renal, thinks my kidneys are dysfunctioning, and then I need to go about that. All right, so good job, guys. Last one.
I just guessed that. And I was wrong.
Higher the SOFA score, higher chances of mortality rate. The lower you get, so you get down to the 0, 1, 2, 3 range, the less chances of mortality. All right? Let's see who's on the podium.
Not I.
G-
Good job, Jess.
JB, all right, Anna.
And
Haley.
I feel like she's on the podium every time. Good job, babe.
as Hannah usually.
Got fourth and fifth place as well. Okay, good job, guys. All right, last thing, we're gonna do Jeopardy review, just to kind of hone in on some of the stuff you hadn't seen in a couple of weeks, because it's been a while since we've done some of this emergency content. What day is your test?
Thursday.
Thursday, right? So you have a week off for Thanksgiving. Don't come to class Tuesday because that's what? Disaster drill. All right, disaster drill stuff will be posted soon. I've got the prep work and I'll give you the updated information from that. I got it this afternoon. So Tuesday is going to be disaster drill. What you're gonna do with it, you're gonna go up to the lab up here 216, where you do all your skills check off and stuff. Don't get triggered because you're not doing a skills check off anymore. But you're gonna walk in there and it's gonna be mass chaos in there. And you're gonna have to do some triage, workup, that kind of stuff. Identify different types of hazards, like a disaster occurred. So that's what we call a disaster drill. It's a pretty short, simple, sweet to the point type of clinical, but you get full clinical credit for it, okay? The prep work, do the prep work. It's going to help you during the disaster drill, all right? So that's the Tuesday, it's the, December 3rd? Second? Okay, there you go. That Thursday is when you're gonna have your exam. So that's a little bit different than you normally do it, right? That Thursday. And then the following week is what? Essie, final, all right? And then you don't have to see me again until after Christmas.
Did you figure out what time disaster was gonna be at?
I did not, I will ask. And I will send it out, an announcement. Yep. So, I knew I was reading something. Yes?
Could you put there's 20 questions on our test?
There's 20 questions. I can think about it. I still have 20 questions left to put in, so that would,
I just thought it was more fast.
that'd be good idea for it. We're gonna do HESI like we did last time, not gonna give you yay or nay, gonna just let you have your final score. You can come in here, see what you need to make, and go from there. You should have the predictor on your canvas already, so just see what you gotta make, and then we'll go from there, okay? And then bonus points, make sure you finish up your quizzes if you're doing those. You will see that reflected on your transcripts. You won't see that reflected in Canvas. It'll just show you a higher grade than normal. So if you had an 88, you did enough to get you to that 90 mark, you'll see that an A that's been put on your transcript. Okay. Everybody but Sam. Sam, I'm gonna highlight her name so she's in fear.
What?
For the HESI.
Oh, I don't know.
So there's what, 12 of y'all? Yes? 12?
13.
There's 12 of y'all, we're missing one.
Oh.
So 12, I need 3 groups of 4. Do y'all wanna do captains? We can do top 3 captains, or do y'all just wanna split up into groups? I'm assuming these 4 are gonna be right here. Okay, so we got Jess, we got Haley, Hannah, and Stephanie, okay? Y'all wanna pair up with Drew in the back? Okay.
And we'll move Chuck over.
Chuck in the middle 4 over here. That work?
That works.
Natalie, you're in charge of everything.
No.
No buzzers this time, we're gonna do it more singular than we did last time.